Everyone, now just see the numbers are going up on the participants, so we'll just hang on a minute. Not slowed down. We'll start. So we have got a sweepstake going to see how many participants there are. Okay, so welcome to this joint webinar between NSA and Moredun. It is a part of a series that they're both working on together. As you probably well know, Moredun is committed to promoting livestock health and welfare through research and education, and is recognised worldwide for its contribution to research into infectious diseases and farmed livestock. And the NSA, National Sheep Association, is funded by its membership of sheep farmers and its activities involved in every aspect of the sheep industry. NSA's vision is one of helping people keeping sheep to be enthusiastic, knowledgeable, and aspiring to best practice. And that's why you're here today. And if you're not a member of NSA, could I please ask you to please think about supporting the NSA so they can support you. They do a great deal of work for a lot of sheep, well, all the whole sheep industry within the UK. And it'd also be worth noting that if you are a member of the NSA, you get associated membership to Moredun as well, and you can access their website and get a lot of technical detail and documents, including the sheep scab document. I don't know if you got one there, Stu. You might be able to hold it up. Very good. And also, a little bit of housekeeping. I think there's 10 AMTRA points available for today's webinar. Reference A3306, which I think is in the chat. There's also RoSA, but I think you'll probably have to do your pop your RoSA number in the chat, please, and we'll pick it up from there. Any questions? Pop them in the question and answer box, not the chat, if you could. Keep the idle chit chat to what you had for supper in the chat, and then we won't get them mixed up. So this webinar, the future of sheep scab. Not another sheep scab webinar, I hear you ask. Well, sheep scab knows no boundaries, and such is the fast moving world of sheep scab at the moment, with so much going on with regard to scab, like sheep dip disposal, the stigma of scab testing, the RD testing and the RDPE project, and the tools available to us, then it's definitely worth having a catch up again, and especially when you look at the caliber of our speakers tonight. And when I say the caliber of speaker, I don't mean me, but I'll just introduce myself. I'm Kevin Harrison. I'm a farm manager down near Bath. I'm chair of SCOPS, chair of the NSA English committee, NSA English committee. But more importantly, we have Lesley Stubbings, who is a respected independent sheep consultant, as well as the driving force behind SCOPS for nearly 20 years, I think, Lesley. And I won't say how long you've been an independent sheep consultant, but I was working out the other day just how long it was since I think I started working with you, and that was a long time, and it wouldn't do either of us any good if we admitted to how long that was. But yeah, a great source of advice in my career and many, many others, which I think we're all very grateful. And our other speaker is someone I also go to for advice, mainly for hairstyling. It's been very, very helpful to me in the last couple of weeks, how much hairstyle I should go for. I didn't go for the mullet, but thank you anyway, Stuart. It's very kind of you. But Dr. Stew Burgess is a top researcher at Moredun Institute, specialising in the pesky sheep scab mite, and is a great advocate for Moredun and everything that they do there. So I think in the background as well, we have Beth Wells from Moredun, and we have Emma in ANSA. So if you want to ask any questions to them, then as well, feel free. We're going to have a word cloud as well. So we're rattling through it. We're going to have a word cloud. So if I was to say to you, sheep scab, what would your first think of? So I think there is a link there just in the chat now. If you click on that, I believe you can type in the word that comes to mind, and then at the end we'll have like a word cloud, and it'll just show all the words you've put in. Just a little bit of fun on that. I think that's enough from me. So I think we're going to go on to Stuart first. What we'll do both presentations, and then we'll do some questions and answers at the end, if that's okay. And I think before you start, we have our first poll coming up whilst you get that ready as well. So have you ever had sheep scab in your flock? No one's judging you, and no one knows who's answering. So please be honest with this, and don't forget to click the vote bit at the bottom after you click the disc. And then I'll wait for them to put the results up. That's gone from, oh, there we go. Well, that's encouraging. 66% no, I never had scab. 2% more than 10 years ago. 17% in the last 5 years, and 15% in the last 2 years. I wonder how much of those are recurring. Okay, thank you. So close that one. Stu, if you take it away, we'll do another poll in a minute, I think.
Perfect. Thank you very much. Can you see these slides, everybody? Yeah. Perfect. Yeah. Great. Okay, I'll get started. I just, it's interesting from that poll there. So, I mean, that 15%, around 15% is sort of what we would expect to see with, you know, with sort of scab prevalence anyway. But I do just want to make the point that this previous winter has been one of the worst that I have seen across the UK for sheep scab. I have never seen it this bad. So, and I think that's kind of partly what has spurred us on to have this this second webinar now, is really to get across some of those messages around best practice control, but also show you some of the things that we've been doing to try to get on top of sheep scab. So to have some hope there, as well as just those kind of those worrying messages. So with that, I'll get started. Oh, that didn't work. Here we go. Okay, so for those of you lucky enough, I mean, 66% of you haven't had scab, so that's great. So for those of you who haven't seen it before, this is the sheep scab mite here, Sauroptes ovis. And it's a non-burrowing mite. It just infests at the skin level. It doesn't bite or blood feed, it just abrades the skin, and then it deposits a number of allergens in its fecal pellets. And those basically trigger an inflammatory response in the skin. That creates a serous exudate, and it's that exudate that the mites then feed on. So it's quite a clever host-parasite interaction, because they're essentially triggering the response to give them the food source that they need. And then, of course, they've got this wonderfully kind of warm and damp environment at the base of the fleece, and that's perfect for the mites to be able to thrive in. Here's some mites here. You'll never see this many mites again. So, you know, maybe, you know, it's a one-off, which is good. But they're around about just under 1 millimeter across, and cunningly sheep-coloured, so not easy to spot on the back of an animal. And the signs of disease really include itching, rubbing, wool loss, restlessness, and that's all really to try and alleviate the intense itching that inflammatory response is causing. And they will literally do anything they can to alleviate that. And that's why you'll see sheep rubbing up against fence posts, against barbed wire, even, you know, whatever they can find to try and alleviate that intense scratching. This is a really great image by Neil Sargison at the Dick Vet, and it just shows all of the classic signs of scab. You know, you've got wool loss in the foreground here. You've got animals rubbing up against these sort of fence posts, and you can see they've already lost a lot of wool here. And then this animal in the background, he's doing this sort of neck arching and lip smacking behavior that's really characteristic of sheep scab, and that's in response to that allergic reaction. So pretty, when it's like this, it can be fairly obvious. I'll come on to it in a moment. Obviously, it's not always as obvious as this. Here's some animals that are infested with scab mites, just to show you some of those behaviors. These animals were infested with mites just between the withers, and again, whatever they can do to try and alleviate it. You'll see that neck arching, lip smacking behavior here. And of course, kicking away at their sides to try and get at the lesions. And that's why you'll often see mucky sides as well, and wall plugs in the teeth where they've been biting away at the fleece. So the spread of scab is through direct contact. So one animal coming up against another animal and passing mites on in that way. But it can also be through fomites. So that's really anything that sheep then contacts, be that a fence post, be it a handling facility, a trailer, and then the mites will then be able to transfer across to other sheep as they come along and contact the same piece of infrastructure. However, there are a number of carrier sheep out there that aren't showing those clinical signs. And these can obviously just be moved around the country quite innocently because there's no obvious signs of disease in those animals. And that's how we feel a lot of sheep scab actually gets moved around the country by there just being no obvious clinical signs at the time of movement. And this just to show, this is about the size of a 5p piece. This is a recently established lesion. The keen-eyed amongst you will see these little white dots along the base of the fleece there. Those are the mites. Again, really, really hard to find in a fully fleeced animal. But all lesions are going to start at that size. And so, of course, it can take a long time before those lesions start to cause the clinical signs of scab. And this is a picture from Peter Bates, one of Peter Bates's papers from a number of years ago that just demonstrates this really well. So the one on the left here, so that shows the lesion size. And what's that showing is lesion size over a sort of a number of weeks here. And what you'll notice is the first 3 weeks, so up to about 20 days here, there's really no lesion being developed here. The mites have gone on there, but there's not much happening. And then if you look at the graph on the right, this shows the mite numbers. So you can see it started off with around 10 mites. And by about 20 days, those mites haven't really increased in number at all. And so you get this lag phase. And in this is an artificial infestation. That's taken about 3 weeks or so. But out in the field, this could take weeks or even months before we see clinical signs of disease. And then you'll notice here with the lesion that it then goes into this rapid exponential growth phase where the mites then start to increase in population, as you'll see on the graph on the right, and then they start to move across the skin, causing these lesions to expand and grow. And that's when you start to see those clinical signs. So the mites can also live off the host for somewhere between 16 and 19 days. And that's really important when we think about controlling and treating scab, because we have to be aware that they can survive in the environment, and we make sure that we use the correct treatment that's going to prevent reinfestations. Once it gets into a flock, it's very infectious and it can spread quite rapidly. But of course, in any flock where you have an infestation, you'll have a whole spectrum of degrees of infestation. You'll have some animals that are showing those classical signs of disease and others showing no signs whatsoever, and then a whole span in between. So, and again, you're only going to start to see or notice that sheep scab is in that flock when you see the tip of the iceberg there, which is those kind of clinical signs coming through. An infested sheep might not show that for weeks or months, and by the time you're noticing that, we would estimate about 60 to 90% of that flock is going to be infested. Lesley will cover treatments in a little while, but we do rely on injectables. We're going to talk about OPs as well, organophosphate plunge dips, but certainly in terms of the injectables, they are also anthelmintic. So we do rely on these to control roundworm infection. So we do have to try and minimize their use, and always have in our mind that where we are using these for scab control, it's going to be having an impact on our worm populations as well. So we always need to be conscious of that. So where are we with scab now? So it was eradicated back in the 50s and then sadly reintroduced with some sheep from Ireland in 1972. People will be aware we had, kind of compulsory dipping for a good number of years in the UK. That was deregulated in 1992. We were very close at that point to getting rid of scab, probably just a handful of flocks left. But unfortunately, we deregulated, and sadly, scab has kind of gone from, kind of strength to strength from a disease perspective, and is now endemic in the UK. So again, based on that survey that Kevin did at the beginning there, 10 to 15% of farmers seem to experience scab each year. 8 to 10,000 outbreaks a year. I think that's a bit of an underestimate, because that was about 2006 the last time we estimated that. The costs, though, have increased significantly. It used to be about £8 million a year, and I think that we've now got far better estimates of the true costs of controlling scab, and now we're looking at somewhere between 80 and 200 million pounds a year. So big costs involved. There are challenges to control. I mentioned about the macrocyclic lactone injectables and the fact that they're also relied upon to control roundworms. And we also have then the organophosphate plunge dips, but there's no new drugs on the horizon. This is pretty much what we've got to work with now. Routine whole flock treatments are often ineffective and unnecessary, unless you're in a really high risk area. Like, for example, if you're using common grazing, they're not actually, these may not really be worthwhile. Non-validated means of control, I mentioned, and I will keep highlighting plunge dipping for OPs. They are not to be administered through showers or jetters, and we have no evidence to suggest that they're efficacious through that. And it might also expedite the development of resistance to organophosphates, which is not something that we want to be seeing. There's some positives. I mean, one is that the scab is focused in clusters or hotspots, and you can see those highlighted in red here on this map. And that means we have some key control points that we can then start to intervene at. And what's really important is that what we've been doing for the last 30 plus years has not been working. And so the status quo is not good enough. So key thing about dealing with scab is to coordinate control. Farmers need to work together in order to get on top of scab, because otherwise it just ends up moving from one farm to the next and then back again, and nobody benefits by doing that. I mentioned about the potential for ML resistance, and we reported this back in 2018 in the UK. There is clear evidence of spread across the UK of these ML resistant mites. This map just shows where they originated. This is where we first detected them, not so much that's where they originated, but around the English-Welsh border region. And we've now seen spread of that to all regions of the UK, and I can include Northern Ireland in that as well. One very important point to make, though, is that those ML resistant mites can still be controlled with an OP plunge dip. So we can, if you like, get rid of those populations where we do find them. And I know that Lesley will probably touch on this when she comes on to treatments. So diagnosis of scab. So classically, you would find some sort of clinical signs in your flock that would, trigger your concern. You would get the vet out, who would then take a skin scraping from those.
Should we do the poll here?
Oh, thank you, Kevin. Yes.
Yeah, I don't want to give this game away.
No.
So here's your second poll, untitled poll 4, it says there. But how do you normally decide you have scab in your flock? A, recognise the signs based on experience. B, vet wool exam or skin scrape. C, blood test. Or D, assume based on scab in the neighbouring flocks. Don't be swayed by Stuart's first slide either.
Thank you.
I think couple of people are having issues with the polls, but I think most people are seeing them.
Many forms of diagnosis are available, so please don't just.
And they will be coming up, I'm sure.
Indeed. Oh yes, indeed. Yep. Good.
But not necessarily in the right order. Oh, is this bit? There we go.
Oh, here we go. Good.
Vet will examine skin scrape was the top one there, and recognise the signs based on experience. A brave move. A, and blood test. C. D, assume based on scab in the neighbouring flocks.
Perfect.
Okay.
Great. Thank you for that. And I mean, the skin scrape is still, classed as the gold standard for diagnosis, and I'll come on to that now in this slide. So your vet would come down, would take a skin scraping, look at that under the microscope, and then hope to be able to identify mites if they were there. And that's great. And you'd hope to try and find, you know, something like that. That's the Psoroctes mite under the microscope. The problem with this is that although it gives a definitive diagnosis, if they're there, it's clearly scab. Trying to find mites in a fully fleeced animal, especially when those lesions are small, can be really, really challenging. And so the sensitivity of the skin scraping method can be as low as 1 in 5, so sort of 20%. And of course, that's then quite limiting because, of course, if you don't find mites, you can't really rule out scab if the clinical signs are there. So it's a difficult technique to get right, and also a difficult technique to diagnose a very microscopic mite, you know, in a large fleece. And so what do you do then when there are no clinical signs of disease or no current signs of disease? So this animal on the left here is just not infested. There's no mites on that animal. This animal's been recently infested, and as I showed earlier with the lesion development, it might take weeks or months before that animal starts to show signs of disease. So do we have to then wait for that to happen before we can detect the disease? And then on the right here, these are the more complicated ones. So this animal's been infested. It's managed that infestation, but it still has mites, but it's not showing any signs of disease now, but it still is a reservoir for those mites. It can still pass those mites on to other naive sheep. So what do you do in those situations? Of course, because the skin scraping method then is not really going to be suitable. And so it's for that reason that Moredun developed a blood test for sheep scab. And that blood test is very sensitive and very specific, which is great. I should point out that the skin scraping method is 100% specific. Like if you find the mites, it's definitive. But this is pretty good. But there are false positives, around what 3% false positives. It's not perfect, but it's a very good test as it stands. It can pick scab up within 2 weeks of infestation, and more importantly, before clinical signs appear. And so that's really important when we think about controlling scab. It's a whole flock or management group test. So you test 12 sheep on a flock of any size, and it will then tell you whether or not there is scab in that group. I'll come on to how to interpret the test results in a second. But it's a really important tool. It's been about for what 5-6 years now, and I think that it is actually a real game changer because it means we can now find scab before it has a chance to spread, and also we can use it as a quarantine tool to prevent scab from getting into our flocks. So the test works by picking up antibodies against a protein from the sheep scab mite. And the protein that I'm talking about here is one of those allergens that are in the mite's fecal pellets. So the mite deposits those fecal pellets onto the skin, and then the host, the sheep, generates antibodies against that, and it's those antibodies that we're picking up. Those antibodies, though, can stay in circulation in the blood for 3 to 6 months after treatment. And so that's really important. It can't tell us that that animal is infested now, but it can tell us that animal has been exposed to the mite within the last 3 to 4 months, probably. But it isn't able to distinguish between an animal that's infested now and one that's been recently treated. So when we're interpreting the blood results, we need to know about recent treatments and also recent infestations in the flock. And just to show you that, so these show the test results for a number of animals. Here, the test result is down towards sort of baseline. You can see within about this is about 6 weeks here, that the animal shows its highest blood test response. It's then treated, and you can see that those antibody results come down, but they don't come back down to baseline very quickly. And in fact, it takes about 3 months before it comes back down to baseline. But there is a significant drop about sort of 3 or 4 weeks in, and it's that we can use if we look at paired testing. So we can use that to see if there's a drop after treatment to indicate whether or not treatment has been successful. What you'll notice here as well is that these animals were then given a secondary infestation of scab, having recovered from that first one by treatment. And you can see what happens here is that they get this memory response. So the antibodies have already been generated. The B cells that generate those antibodies are there in the circulation, ready to go. And those antibodies get generated really, really quickly. And that actually gives those animals a protective response to sheep scab. And that's really important because that's actually the rationale for us developing a sheep scab vaccine, is the presence of protective immunity. But when we're interpreting that blood test result, it could be anywhere. We don't know where we are in this span of increasing and decreasing antibody levels. So it's really important we have that information about treatments and infestations when we're trying to interpret those blood test results. Why do we need 12 animals? So if we just test one, if we just pick one randomly, of course, the chance of picking this one orange infested animal are obviously quite small. But if we pick a larger group, then of course that gives us a greater chance of detecting it. And the magic number appears to be around 12 animals. After that, you don't get any real benefit in terms of the increasing the accuracy of the test. And so 12 is a good balance between testing everything and testing a few to make it cost effective. Yeah. How does it work in a natural outbreak? So again, much like the rest of the country, you know, Moredun is not immune to sheep scab. One of our farms had scab a number of years ago. It spread from an infested ewe that was very kindly put through the wrong gate, having got out onto the road. That infested an experimental flock out at Moredun, and it was we were quite. I personally was quite excited by this. My wife, who was running the trial, was not particularly excited by it at all because it kind of ruined her experiment. But I was very excited because it meant that we now had this beautiful model to look at how to use the blood test in an infested flock when we knew when the infestation had happened. We knew the animals weren't infested before, and we had blood results all the way through. So I went out and examined all of the animals. There are 159 animals in that experiment. And what I saw was 27 of the 159 were showing signs of disease, be that obvious lesions or behavioral signs of disease. So that means 132 of them were showing no signs of disease whatsoever. But 105 of them were positive by that blood test. So even I like to think that I know what I'm looking for when I'm looking for sheep scab, but clearly I don't. You know, and I can't be trusted to use my experience because I just couldn't find those, but they were infested. They were just at a very early stage. So it shows how difficult it can be diagnosing just on the presence of clinical signs, but it shows how good that test can be to pick up those subclinical infestations. So these are some lambs that were infested at Moredun. I just want to show some of these early signs of scab. So you can see in these animals, there's just a little areas of discoloration on this green animal on the left here around the back leg, and on the orange coloured animal there around the flank. And they're just areas where the sheep have been turning around and just nibbling away at the fleece a little bit, just to cause some discoloration. And if we then zoom in a little bit, you can see those a little bit more clearly. You can see the sheep have clearly been kind of pulling away at that a little bit. And if we then cut the fleece away, you can see in the green tagged animal, there's a lesion there. That's around about a 50p coin size lesion, maybe 50 to 100 mites in that lesion. It's quite well defined. It's an early lesion, and it's going to now start to expand. The animal on the right here with the orange tag, nothing there. I couldn't find any mites on the skin there at all, and a couple of other areas that I looked at on that animal. But both of these are positive on the blood test, so they are both infested. It's just really hard to find the mites. Even when you can see obvious areas you might start to investigate, it can still be very difficult to find the mites. And again, it's just to show that those early lesions can be really small and really hard to find. So the testing advice for scab is to assume that everything coming into your property is a risk of scab. Tups particularly can be a real high risk. Overwintering animals, there's a whole range of different risks here. Whenever you're bringing animals back onto your property, purchased stock as well, you just need to be suspicious. Keep them separate from the rest of the flock for at least 2 weeks, and during that time, observe for signs of disease, and then test them after 2 weeks. And the reason for waiting 2 weeks is going back to how the ELISA works. So it will take 2 weeks for the sheep to generate those antibodies. And if they've become infested on the way to your farm, then you need to give them that time in order for those antibodies to be generated. And then, of course, you can treat if you need to treat, knowing that you're treating for the right thing using the right drug, and that's really important. And of course, that can then save you money, because if it come back negative, then you don't need to treat, and you've saved yourself some money, and also you're not using those products unnecessarily. That's really important, because the test can distinguish between sheep scab and lice. It doesn't cross-react with lice, and of course the treatments for these can be very different unless you're using something like an organophosphate dip. So again, you want to know what you're treating for and why. Just want to show you why biosecurity is so important. This is an infested ewe here. This is about, I think she's about 4 weeks into an infestation. The lesion's going to be around about the size of an A4 sheet. These animals here are all completely naive for scab. Very quickly, they obviously flock together, and we start to see her sharing those mites around. And I can tell you, after a 2-week co-housing, all of these animals become infested. And again, they all become noticeable on the ELISA first, which is really important. That's the blood test. Sorry. So Kevin did touch upon the RDPE project and how we've been using that sheep scab ELISA to try and control disease, sheep scab, sorry, in different areas of the country. And I'll come on to the map in a moment, because I'll go back to that map that I showed you first. But this map on the left here just shows you actual outbreaks of sheep scab. Each of those black marks is an outbreak of scab. So you can see, you know, those outbreaks are fairly well clustered into different parts of the country. And then when we show this map that has the red clustering, this map isn't showing outbreaks of scab. What it's showing is the density of the sheep population and the degree of connectivity between properties. And by that I mean the animal movements between properties, because all of these are risk factors for sheep scab. And what you'll notice is that actually that as a prediction works out pretty well. So we can use that information to then work out where might be good hotspots of sheep scab. And that's exactly what we did for that RDPE program in England. And then what we've targeted are areas in Herefordshire and Shropshire in the Midlands here, the northeast of England, and then the southwest in Devon, particularly around Exmoor. So this was funded for 2 years by the RDPE, working with clusters of farms within those hotspot regions. And these are the different regions that we worked in. These are the coordinators who were really important in driving that project: the Farmer Network in the north, ADAS in the Midlands, and then the NSA down in the southwest. And so what we aimed to do was to recruit 300 farmers, 100 in each of those 3 regions, and we fully recruited that. So again, full credit to those coordinators who were able to recruit all of those farmers in those regions. We then identified clusters of farms. So they were, I'll show you that on this next one. So basically clusters were based around farms that were contiguous, so they shared boundaries. They may have also shared, for example, common grazing. If they didn't have contiguous boundaries, then there should be a maximum distance of around ½ a kilometre between those boundaries. And ideally, they'd have some natural boundaries, be that A roads or rivers, just to give it a bit more definition. And then what we asked really importantly was that farmers taking part needed to report and treat any scab outbreaks, quarantine and treat any animals in, but also be willing to share their blood test results within their clusters and only within their clusters. And we thought that might be a bit of a challenge, but actually they were pretty willing to do that, which I think is great. And I think we are starting to see that stigma of scab lessening. And that's probably because Lesley and I keep talking about it, which is probably helping. So then we went, again, I say we, but those coordinators visited all of those farms, 300 farms, all in the middle of lockdown as well. So, you know, a lot of these visits were done by telephone. Some were done in person as well. They obviously gathered information on the individual properties and also explained to those farmers how the project was going to work. We then held cluster meetings introducing the project, and then we held further cluster meetings, keeping people informed on progress. and also more recently, actually, to look at how we then build on what we've done in this project, which I'll come on to in a moment. But we wanted to not just stop at the end. We wanted to make sure that we left a legacy in these areas so that people could continue to control scab using the tools that we had then provided them with. And those tools were around the blood sampling. So again, we had 2 annual rounds of testing, identifying where sheep scab was, and then coordinating treatments where necessary. And then following that up the next season to try and make sure that we really hammered down on scab. The vets were really heavily involved, usually the farmers' own vets. And they were also able to go out and do advisory visits for each farm, looking at all the different risk factors on farm, giving them best practice advice as well for controlling scab. So some of the lessons that we've learned from that were really high levels of participation. The farmers were really keen to work together to control scab. I think they really saw the benefits of this type of approach. So the interest was really good, but it was totally dependent on the passion and drive of those coordinators, and in some cases they were vets as well, and I think where the vet was central to it, it worked really well. Most of the farmers were really positive. Some were less keen to take part. They were in the minority, and the coordinators worked really hard to get those individuals on board, and in many cases they were successful in doing that. We were fully recruited. We had more farmers wanting to join, and so the coordinators did have to manage expectations, and we did unfortunately have to turn some individuals away, which is probably the last thing that we wanted to be doing. The bottom line is we have seen significant reductions in the cases of scab across all 3 hotspot regions. So that's great. Obviously, that varies from region to region, but again, I think we set this is what we set out to achieve. We didn't set out to eradicate scab in these areas. We set out to try and reduce it and set up a system by which you could reduce it further and further as you went through year on year. We did confirm further ML resistant mites in one of those regions. That was down in Devon. We were able to deal with that using an OP plunge dip, which is great. And we now have those mites at Moredun for research into the mechanisms of resistance. Across the project, we saw issues with persistently infested flocks. So animals in these flocks were testing positive on the ELISA, but not always showing clear clinical signs of disease. Now, in many cases, these then manifested with time, but not in all cases. And these were often associated with the use of common grazing. And this goes back to that individual that I spoke about when I was talking about the blood test there, of that persistently infested animal that's got scab, is managing it, it's not really showing any clinical signs of disease, and it's probably developed a degree of protective immunity. And the problem then only becomes apparent when new animals are moved on, or those animals are then moved themselves, and then of course they start to spread the disease, and that again can take many months before that happens. So that was a real kind of eye-opener for all 3 regions, in fact. And I'm going to hand over to Lesley. Yeah. Do you want me to stop sharing, Lesley, and you can share your own
Stuart.
slide?
Yeah, that would be great. Thanks. Yeah, that's good. And perhaps, Emma, we could put up my first poll, and I'll just get my screen to share. Brilliant. It's not working. So is everybody doing that poll while I fight with my screen?
Do you want me to share it from?
No, it's okay. No, just leave it for a sec. We'll do that poll, and I'll just I'll sort it. Don't worry.
I'm chatting away. You're on mute. So this on the poll, I assume you're going to have a picture come up, are you, Lesley?
Yes, I am. Yeah.
Yeah, so we'll do Laura Smith's question whilst you're battling with your technical skills there, Stu. And Laura's asked, if using the blood test as a management tool, when would be the ideal times to blood sample on the whole flock approach?
Oh, here we go. Sorry, I was on mute. So again, it depends. If you're using it as a quarantine, then that's great. Then you would test as animals are coming in. Quite a lot of these programs we try to test in the autumn, because I think that's quite a good time, because it gives you a window of opportunity then to be able to deal with it before you get into those more difficult times of year. So generally, we've been talking about kind of late on in the autumn, probably sort of September, October time being a really good time to look at blood testing.
Right, thanks.
Can you see my screen now, Kevin?
No.
Okay.
No, Stuart, can you put yours back up?
Yeah, I can do that here. Give me 2 seconds.
Just a minute. I think I've yeah, no, give me it back again, Stuart.
Oh, okay, sorry.
You got it now?
Yeah,
Yeah,
we can see that.
so,
Okay, yep, sorry about that. There was some security problem on it, so sorry about that. Okay, right, so we've got this one now. So if you walked into a field and you saw this, what would your first reaction be? Be as honest as you like.
So ask the vet to, oh, that's gone. That means
Okay, there we go. Here we go. Ask the vet to do a skin scrape, dip in an OP, and oh, there we go. Ask the vet to do some blood samples. So Stu, I think the blood sample side of it's gone up in the since you started your presentation. So that's brilliant. 2% would panic. Yeah, I must admit, when I walked into that field, it was sort of like, yeah, right. I know what that is. Okay, right. Thanks very much for that, and we'll carry on. Okay. So, obviously that flock there was pretty obviously a big problem, but just to make the point that, sheep scab can sometimes be very obvious. Other times, as Stuart has said, it's not going to be obvious. It's going to be a biosecurity issue when you bring tups in or whatever, or it's going to be when you bring breeding sheep in, or it might be, you've been to a market, it may even that you've been to a market where there's sheep scab and brought it back in a trailer or whatever. So the testing side of things is really important. And what I want to talk about just for the next 10, 15 minutes or so, 10 minutes or so, is just about the treatment side of things. If we are going to have a future in terms of being able to control sheep scab, it's really important that we treat it properly for lots of reasons, not least, as Stuart has alluded to, that we need to look after the treatments that we've got, because basically we've only got 2 options in order to be able to treat and control sheep scab. The first one are the injectable macrocyclic lactones, and I'll show you quickly the range of those that we've got in a minute. And the second one, of course, is plunge dipping in an OP, and we'll look at that as well. As we've heard, we have now got cases of resistance to the injectable MLs. Fortunately, in the last 12 months, the Moredun have been able to prove equivocally that those resistant mites are dipped if the sheep are dipped properly in a plunge OP dip. But the emphasis has got to be on us doing that properly, and we can't now afford to start playing around with OPs and not using those properly, because all the experts tell us that whilst we haven't got resistance to an OP dip at the moment, the chances are we will at some stage in the future. That might be many years down the line, hopefully, but if we abuse this product, then it won't be so many years down the road before we actually see it. So it's really important that we actually use these properly. Now, if we just look at what's happened to the treatments that we've used since, well, over the last 30 years, actually. It doesn't seem like 30 years since 1992-3 for old people like me, but it is 30 years. I mean, don't take too much notice of all the different bars in there, apart from the blue one is the one that you really need to look at. In 1992-3, you can see that this is all ectoparasite treatments in sheep in the UK, that nearly 90% of our treatments then were the blue line, they were an OP. The green line is when we still had the synthetic pyrethroid dips, which of course we lost quite a while ago now, nearly 20 years ago now, because there were issues with resistance in them, particularly with flumethrin, but also because they did pose a very serious threat to the environment. And so we lost those as a tool in the armory, and we only had OP left. But you can see here that by 2017, which is the last really accurate figures that I've got, we were down to about 10% of the OP. I did have a discussion with Bimeda, who make the only current OP dip that's on the market at the moment over the last couple of days, and they're telling us now that that has gone up by at least 25% since about 2020. So we're beginning to see people moving back towards an OP. And I just think tonight it's worth perhaps just us having a think about why that might be, why you think that might be. And if we're going to do that, and we do need to do so for the reasons we've been talking about already, how we then make sure that when we use that OP, we do it effectively and we do it safely from both a human, an animal and an environmental point of view. All of those three things are really important. But I think it's really stark for those of you as old as I am. You know, think back 30 years ago, it was just dip. And then you see how the injectables particularly took over in sheep scab control in those intervening years, and things are just swinging back a little bit now.
Did you have another poll, Lesley?
Yep, I did. We can put that one up now if you like, Kevin. Yep.
Yeah.
So if you had a choice, what would you use to control sheep scab? I'm going to just take, yep. So you've got an insecticide, non-persistent, we'll come on to that in a minute. If you don't understand that one, a poron, an OP contractor, an OP using my dipper, an insecticide with persistent activity, and a jet or a shower.
And be honest, because
be honest, please, because no one knows who you are. Just be honest. I mean, we're just really trying to get a nice feel for where people are, and it helps us to know what we need to do in the future to help you. How are we doing? Excellent. Okay, so that's interesting, isn't it? So already there we are, 57% of people would be going for an OP using a mobile contractor. And I will come to that at the end, because obviously some of you will know that's an area where we've been spending a lot of time and effort to try and help people get the best experience out of that. Nobody's put a jetter or a shower. Excellent, excellent. The message is getting out there. Fantastic. Thanks very much, Emma. That's brilliant. So what you've got on this table, we don't need to dwell too much on it, and I'm sure people can go back to it if they want to, and you'll find all this information on the SCOPS website as well. Is we've got at the top there, we've got obviously the only OP product that's available to us, and diazinon gold fleece, used as a plunge dip, and you will get at least 8 weeks protection with that, which is longer, I think, than some people think. And then you've got an array of different injectables that we can use, and the real distinction between them are between moxidectin, which are the ones at the bottom, in terms of, you know, you will get, particularly with moxidectin 2%, you're going to get persistency, and you will get 60 days cover. With 1%, you'll get 28 days cover. With the others, the ivermectins and doramectins, you're not getting any cover, you are purely getting treatment, and we'll have a talk about that, because that makes a big difference as to when you if you use them, what you have to do to make sure that you get an effective use, should you choose those. Okay, so, and then there's all the different product names within that, but that's your big distinction. Are you going to use a persistent, or are you not going to use a persistent if you choose to go down the ML road? So what are the pros of the injectables? Why did they take off so much in the mid-90s? And I think all of us would probably recognise that, you know, if they use correctly, they are effective, and they're relatively inexpensive. They're relatively available. And you don't need specialist kit and infrastructure to be able to use them. And of course, one of the things that happened with dipping was that it got more and more expensive to maintain dipping equipment, certainly to put new dipping equipment in, and also to dispose of the used dip wash when you had dipped. Lots more regulations. We'll touch on that later, and we've got a load of links in the chat for you to be able to follow that up if you need more information. But it was attractive, wasn't it? And there was also quite a lot of talk back in the 90s. The SPs had rather sort of messed things up a little bit environmentally. And then there were the concerns about the human element of using an OP, which we'll just mention again in a few minutes. And they also cater for small numbers of sheep easily. So if you're bringing in from a biosecurity point of view, if you're just bringing in a small group of tups, or, you know, a small group of animals are coming in that you've bought in, it was always going to be a bit of a challenge to think in terms of dipping them in the days perhaps when we didn't have quite such good access to mobile contractors that we've got now. And they're relatively safe for the user. You don't need any specialist PPE or whatever. And I think this was one of the big elements that largely drove that away when we stopped compulsory dipping. So we stopped forcing people to dip. The injectables came along, and they had, I'm sure you can all think of probably some other pros to go with them as well. But, you know, there's nothing wrong with them if they're used effectively. But there are a few cons we're going to cover as well. Okay. So accuracy and technique are critical, and it is very, very easy to miss a sheep if you're treating with an injectable. Miss one and it's infested with sheep scab, and you haven't used the persistent, and you've reinfected the whole lot. So, you know, it is absolutely critical to make sure that we use these really accurately, absolutely the right dose rate. It's not an Olympic sport. Every animal is treated properly. And that means we weigh them, and it means we get the injection in the right way. And obviously, if you're using the moxidectin 2%, that needs to go in a very special place at the base of the ear for that to be truly effective as well. So it's really important that we get that. So it's the only ectoparasite they cover as well is sheep scab. Now I've put a little star there because actually that's not quite true. They will do nasal bots as well, but nasal bots is a very specialist thing, and we don't want to go around treating for those unnecessarily. But as far as the mainstream ectoparasites are concerned, they will only treat sheep scab. A lot of confusion there because they will actually kill sucking lice, but they won't kill biting lice, and we don't get sucking lice on sheep in the UK, or I'm looking at Stew now, or so the experts tell us. So that can be a bit confusing, but it does mean if you're going to use an injectable, we would always suggest that you've got a diagnosis. But if you're going to go for an injectable, don't use it and then a month later think, oh Lord, that didn't work, did it? And we've had so many cases of that in the past where people have used an injectable. They thought it was scab, it wasn't, it was just lice, and they could have dealt with it very, very differently indeed, and saved themselves an awful lot of time, effort and worry, really, if they'd had a proper diagnosis. And the other thing about them is they don't kill the mites immediately. So really, they're only, if you can imagine, you're injecting something in there. So what you're relying on is the mites actually eating, hoovering up the medicine when they're going through this exudate that Stuart was describing earlier on. So they're only being exposed to the ML when they're feeding, and they won't kill them straight away. So two things: you can still see itchy sheep 2 and 3 weeks later, because obviously there's still residual fecal pellets and so on there causing an allergic reaction. And the other thing is, if you're not using a persistent product, you've got to move them somewhere clean, because otherwise they're just going to become reinfested as well. So, you know, one of the other things is this issue of resistance. And now this is becoming one of the main cons of us using injectables really widely, and certainly as widely as we were. I mean, at one stage we were seeing some flocks in the hills and uplands that would no longer feel as though they had access to an OP, injecting whole flocks several times over a year. So it's no surprise, and that's no criticism of them, that's what they felt they would have to do. But, you know, no surprise then that we have started to see resistance in scab mites. But from a SCOPS point of view, our main concern to start with was that we were worried that every time we used one of these products for scab control, we were also increasing the speed at which we were building up resistance in worms as well. So that both of those things are something we need to think about very carefully now. And we would be encouraging people now to use the OP dip where appropriate and try and take some of the pressure off the ML injectables. And I have also just put a little thing in there. I think Emma will probably put it in the chat as well. There's a link there because one of the issues that we have is that sometimes people use an injectable and they think it hasn't worked, either because it's not, they've missed a sheep or two, or they didn't get a diagnosis or whatever. There's just a little thing, a little form there to help people if you think you are in that position, just to take you through the process of the sorts of questions to ask before you do a knee-jerk reaction and assume, oh, heck, I must have resistance. It's still quite unlikely for a lot of people. It's a possibility, but there are also lots of other reasons why you might not have had such a good experience and such an effective clear rate. So the other, just before I go from that, I don't want to hammer the poor old injectables too much, but the other consideration, just very briefly as we go through, and somebody might want to come back on this, that of course we do have to now also consider, we've never not considered it, and these products are all properly tested and licensed for their environmental impacts, so we're well aware of what they are, but increasingly, you know, we are trying to take some of the loading off, and the MLs do have that effect on dung flora and fauna, and so it's just something to bear in mind, notwithstanding the fact we'll come to the fact that obviously OPs have got environmental challenges as well. So let's look at the dipping in OP. What are the real advantages of doing that? The first one, I think, and Stu did allude to this as well, is that an OP is broad spectrum. It will nail all of the major ectoparasites, ticks, keds, lice, sheep scab. It will nail all of them. Now, that's not to say that we don't still need to use particularly the blood test, because obviously we don't want to be using OP just in case. We want to be using OP in a coordinated way when we know that there is going to be, there's likely to be, or we've shown, sorry, that there is sheep scab actually present. But this is one of the advantages is, you know, it will be a broad spectrum and it will deal with all of them. And another one, of course, is we've said it will kill mites that are resistant to the macrocyclic lactones. And if carried out properly, an OP will give you at least 8 weeks protection from reinfestation. Now, that's really important, particularly in common grazing areas and when we've been doing a project like the RDPE and coordinating treatments, because it means obviously from a practical point of view, not everybody's going to be able to dip on the same day, but it gives us quite a reasonable window of time where a group of farmers who are in one of these clusters can dip, and you still got good overlap between the groups of sheep in terms of that protection. So it really does give us a much better shot at being able to get the whole of that geographic area with every sheep covered against sheep scab over a period of time, which is very important in terms of beating the little devils. But we've got to do it correctly. and we have to do it effectively and safely. So I just want to finish off really just running through what those elements are briefly, and then, you know, we'll leave you with some other stuff and some links that you can look at afterwards. So in terms of doing it correctly, many of you have heard this before. They need to be in the bath for a minute. They need to have their heads dunked under. And I just want to show you this to show we're not making it up. It's not something that's appeared out of nowhere. There's been a lot of work done. You've heard Pete Bates's name mentioned earlier on tonight, and this is some work that he did. And you can see here, you know, if they're dipped for less than 60 seconds, the failure to cure rate to cure scab is 60%. So, you know, the 1 minute at least is based on the fact that we are looking for a good kill rate. It's not something that's just been brought out from the annals of history, because that's what the old MAF rules used to say when we had to dip compulsorily. And there you are. That's what we used to do in the old days. There's the two bobbies there, looking over the fence while the sheep were dipped compulsory to make sure that they were in there for a minute. And they'd come and they'd literally have a stopwatch, or the MAF man would come, have a stopwatch, and they'd watch them be in there for at least a minute and watch them have their heads dunked under at least once, preferably twice. And the second one is depletion. You know, if we're going to use a sheep dip properly, it's just another example. You can see here that once you get down to, you know, you're going to get to the 500 ewes going through that bath. By the time that line comes down again, you are going to be through the solid red line, and that means you're below the minimum effective concentration. So all of the instructions that we give in terms of replenishment rates, emptying the bath and at this point and refilling it and starting again, they're all based on really good tight science, and I can't really emphasize that enough. So it's really important that we actually get that right. Why does it have to be a plunge dip? And we still hear people saying, well, you know, we'll use a jetta and a shower and it works. No, it doesn't. The chances of you having a cure rate, 100% kill rate on a shower and jetta are 0. Because what needs to happen is that the the OP needs to get down to the skin. You know, you heard Stu talking about this earlier on. Those mites in this sheep, they're hiding underneath those crusty bits. They like to be around the outside of the lesion. And, you know, in a fully fleeced sheep, you know how much it takes to get down to the skin. They've got to be in that bath. Plus the fact in the axillae, and equivalent of our armpits, under the back legs, in the ears, and in the periorbital bits on the head, they will also stay there, and a shower and a jetta is not going to get the chemical to meet all of those. So it is really important that we have a big red cross on that, and we have a big red cross on that, and we have reached the stage now where, you know, hopefully you've seen our advert over the last 2 or 3 years. But we can say now that it's illegal to use an OP through a shower or a jetta. And there are cases that are being followed up now by the Veterinary Medicines Directorate. And nobody wants to get heavy on anybody. But unfortunately, if we want to keep OPs working for us and be able to control sheep scab in the future, maybe, you know, there needs to be a little bit of heavy-handedness, hopefully not too much. But please, please, do not put an OP through a shower or a jetta, or we will be in trouble. And I know some people will say, well, I'm only using it for blowfly. It's not licensed, it's still not legal. And even if you're doing that, if there's some sheep scab mites about that you're not aware of, they could be exposed to a lower limit of a lower level of the OP than they need. In terms of human safeguards, we've addressed over the years, I say we, the industry has addressed some of the concerns that really led to the OP falling out of favour in the 90s and early 2000. And obviously, you know, the closed systems was one of them. The concentrate is the most dangerous part as far as the human being is concerned. So using the closed system means that the human being doesn't need to get near the concentrate. It can be transferred to can, to dip really safely. And of course, PPE, absolutely absolutely has to be used. And this is another reason, I think, why people are moving towards the professional mobile dippers, because these guys are doing it day in, day out. They've got all the right kit. They know what they're doing. They know how to do it safely. And it takes a lot of that concern away from you, the end user. We have to think about the environment. Now, the top slide is really grainy because it's very, very, very old, and good job too. It's where I come from in Cumbria, and that's how we used to dip sheep. You dam the river, stick whatever it was used. Now, I don't even want to think about what it was they were using, and dip the sheep like that. Now, we're a long, long way from that, obviously, these days. But the bottom slide does show we do have to think really hard now about where we might site a dipper, even if it's a mobile dipper, if it's near a watercourse or a lake, perhaps. No, we do have to think very hard about that now because of the risks that there can be. We have to think about draining and drying pens, having enough of those so that we're not actually letting dripping sheep go out before they're ready, so that they can actually contaminate any water courses, and really not having access to water courses post dipping. So, you know, not turning out sheep into a field that's got an open water course. They've been in the yards for the last few hours. They're dead thirsty. And the first thing they're going to go and do is they're going to want to go and drink from the river. So in mitigating those environmental risks, and when I come to the code of practice, that covers all of these sorts of things in a lot of detail. So you can follow that up a little bit later on. And then we've got to think about the really thorny one, and that is the disposal of the used dip wash. And it's got to be disposed of in accordance with the groundwater regulations, and that requires a license to dispose to the land. Now, the actual regulations do differ from devolved nation to devolved nation, and the costs are equally differ quite a lot. But generally speaking, the license that you apply for will allow you to spread a certain amount. For example, 5 cubic meters is the lower level of license in England. You pay more if you want to spread more than 5 cubic meters. And it will be on a specified bit of land that the Environment Agency or SEPA or NRW have approved is suitable for you to be able to do that. NRW, for example, in their rules, it clearly says that you can't do more than 3 applications in a year, three applications of used dip wash in a year. So wherever you are, we will put the links in the chat to the different environment agencies so that you can follow up the one that you want and just check what the actual regulations are. But I know in Wales, for example, the cost of those licenses are they either have or they're about to go up quite dramatically. So they vary a lot. You've got the EA, SEPA in Scotland, NRW in Wales, and DERA in Northern Ireland, and those links should all be in the chat for you to follow up. For a lot of people, spreading to land, if you're in very sensitive areas, you're not going to be able to do it. You may decide that, you know, applying for that license, you apply as a one-off fee and then you've got to pay an annual fee. Then it might be that if it's your own dipper, you can have it taken away by a registered waste carrier. You do have to check that they're properly registered, that they've got the proper codes for the agency to be able to do that, but it can be taken away in that way. And there is work now ongoing again to look into the neutralizing enzyme for an OP, which would mean that, you know, after dipping, you could put the enzyme in there. It was never commercialized before, but we've seen it experimentally before, and it would neutralize it to the point where you'd still have to have it taken away, but it would be deemed much less hazardous in terms of, and that would reduce the cost and make it quite a lot easier. And I would assume there would be more waste carriers who would be able to do that. And the other thing, of course, is not in terms of disposal. Other cans, you know, not an uncommon sight. I don't think there is well, there might actually be a sheep dip can in there, just having a look now. But it's really important, obviously, to dispose of those cans properly. And I did have a look at the data sheet for Gold Fleece today again, and there are some very clear instructions as to how you should wash out the can when it's finished and it's empty. Wash it out through the closed system into the dip bath, and then, you know, look into your local as to how you then dispose of the empty can when it's been washed out. But very, very important that we do that with all medicines, not just sheep dip, but obviously sheep dip, it's really important. So because of all of these issues with trying to get to use an OP properly, you know, the cost of disposal, the cost of the infrastructure, and the concerns that some people have had, we have seen a big increase in the number of professional mobile dippers in the last few years. And some of you will have seen one of these dippers. There's quite a lot of them about now. But, you know, the cage dippers where they are actually dipped into the dip, people get worried about that when they first see it, but the fail safe is up. So if anything happens to the hydraulics, it automatically comes up, so we don't drown any sheep. They work really, really well, and obviously with that system you get a cage full of sheep and you're in total control as to the immersion and the dunking and everything else. So we do see a really, really good level of efficacy when these are used and used properly with replenishment and everything else. So the mobile dipper, you know, the idea is that they would provide a full service, so including the supply of OP. One of the things that has just been sorted out recently is that I know many of you will probably have had your dipper supply you with OP in the past, but that has been a bit under the radar. We've now got an agreement which is suitable to the VMD, which means that your mobile dipper can use their certificate of competence if you haven't got one, because we still do need, before we can buy a dip, we need the certificate of competence. That means you going through that system. You can use their certificate of competence. As long as you give them their details, they can then go and get the dip and have it prescribed on your behalf, and then it's all above board and it can be used like that. So that's another reason, I think, why a lot of people, and the people on tonight, have also been doing that, is using a mobile dipper. They hopefully do it effectively, safely, and they will also talk to you about dip disposal. So if you haven't got a license, then they will talk to you, they will take the dip away. It will be part of the service that they provide. And they have got various means whereby they can store it and then have it taken away by a waste disposal company or whatever. But it does take away a lot of the issues that people are concerned about, for a fee, of course. But what you've got to do is to make sure that they are professional and that they are following the industry code of practice. Now that's really important, because, and it's important, I think, that as farmers and users of these dippers that are on the webinar tonight, it's incumbent on everybody. You know, if you're paying for a service, then if I was paying for a service, I would want to make sure it was done right. So the code of practice, which we should go through to now, is quite detailed, and it takes you through the prescribing and everything else. And hopefully, if I can scroll, it's not so easy to scroll down on this. It would take you through everything that you need, and it takes you also right the way down through what, as a farmer, you need to do for the dipper. So you need to talk to them about the sighting. You need to talk to them about how the animals should be presented, not using certain products like a yellow drench within 14 days of dipping, not dipping wet sheep, etc. So the code of practice has been developed by the industry. You can see everybody who's been involved in that and who's supported that, but it's as much for the farmer as for the professional dipper, so that you can both actually have a clear understanding of what the expectation is. And that's really important, that we try and make sure that people do that. I'm trying to avoid cowboys You know, if somebody's not prepared to sign up to that code of practice, then my advice to you would be, why would you pay for a service that you're not sure is going to do the job? And so, you know, put the pressure on. It's there, and a lot of people now are actually using it. So I think, Kevin, that's me. It's a quick run through, but hopefully, you know, that there's a lot out there now to help people. We do see people moving back to the OPs, and that's a swing that's going to continue, but there's a lot more information and a lot more help out there to enable you to be able to do that effectively and safely.
Right. Thank you, Lesley. Well, everyone's certainly getting their money's worth tonight. I am conscious of time, and we do have a few questions in here, but we could do some quick fire ones. Stu and Lesley, is there an effective disinfectant made by media or anyone else for using an equipment to use on equipment like scanning crates, hurdles? This question often comes up, so I'll let you give the professional answer.
Do not use dip wash for that. So hypochlorite, bleach-based disinfectants will work really well against sheep scab mites. That'll kill them as long as you've used it at a reasonable concentration. Also, FAM, iodine-based farm disinfectants will work again. They'll work pretty well. And again, it's all about mitigating risks. So even a spray washer, something like that, will remove most of the material and most then of the mites and wool, from a sort of a handling facility or a trailer. So it's about reducing the risk there. So I will point out, Kevin, there's another couple of slides. I'm really sorry, but it's to give people, it's the hope slides at the end that are really important.
What, hope we're near the end?
Did
you want to do that? Did you want to do this before the questions?
I'll do them now because it'll be super quick, and it'll probably answer a couple of the questions as well. So
yeah, no, crack on then. Yeah, that's fine. Yeah.
Good man, thank you. Can you see these slides now? Yeah. That okay?
Yeah.
Good. Okay, so I guess the question is, why then try to control scab now? So, the fact that we've got resistance already to the MLs, that means there will come a point in the future that we can only really rely on the OP plunge dips. There's nothing else coming through at this moment in time. There was a question about OP resistance. At the moment, we do not have evidence of OP resistance in the UK. However, there are cases of OP resistance in South America. If we keep jetting and showering, we will, without a doubt, see resistance to the OPs, and that will spread, and we will then lose those in the future. So I just hope that that's a very long time away. But again, we need to use these compounds correctly to keep them, to maintain that efficacy. Now is a good time because there's a will to act from government and industry. We've seen that through the funding of projects like the RDPE. The injectables still work. There's still a really important role for those in control, but we need to use them correctly. Plunge dipping works great, but not through showers or jetters. The blood test is there. It's a game changer. It really allows us to get ahead of scab for the first time and coordinate our efforts. So that's really important. And again, dealing with scab can save you money, save you time, and improve the overall welfare of your stock. So there's win-wins here. It's great. Moredun are also developing a vaccine against sheep scab. It works, but it is still going to be about 5 years away from being commercially available. But that, I think, is the longer term sort of prospect here. I mentioned about kind of will to act from government. That's the RDPE project we've spoken about. There's also a project in the Cumbrian Commons that we're working on at the moment. In Wales, we've got the all-Wales sheep scab eradication programme starting this autumn. Again, big efforts there in Wales to control scab. In Northern Ireland, we have a scheme running just now with Moredun, AFBI and Animal Health and Welfare Northern Ireland to try and understand the degree of scab and look at how best to control it in Northern Ireland. And then in Scotland, we've been running a number of control programs, and just now we're running one out on the Western Isles of Lewis and Harris, funded by the Scottish government. So we're starting to see this sort of four-nation, joined-up approach, but we're really at the beginning of that journey, and that's where we're now looking to for hope about controlling scab into the future. And so what are the next sort of 5 years going to look like? Well, we've seen about getting out best practice advice. That's really important. And Lesley's done a great job of showing why that's so important if we want these treatments to work and to keep on working. Coordination's critical. And I think that through a lot of these programs, have shown that people are willing to work together and are happy to work together. They just need to be given the tools and the empowerment to do that. And that's what a lot of these projects have helped. That ELISA, that blood test is there, and we've used it in a number of these programs across the UK. Focusing on hotspots and critical control points gives us the best bang for our buck. So if we attack those hotspots, it doesn't just dampen scab down in those hotspots or help to control it in those hotspots. It actually has an impact on scab nationwide because it stops scab moving around. And that comes to the critical control points of markets, which are crucial if we want to limit those long distance movements of sheep scab. And that's clearly how those resistant mites have spread around the country. And then all of this then hopefully lays the foundations for that vaccine coming in at the time that we have reduced the overall impact of scab sufficiently. And I think that is our sort of pathway, if you like, to the future. And obviously just to say thank you for everybody for their time and patience. And of course, we're happy to answer any of the remaining questions and anything else that comes up. But I'll stop sharing so we can actually see each other then. So perfect.
That's great. And it's a bit like I said earlier on, there's just so much going on, isn't there, at the moment? And it's great, and to have such a concise and detailed presentations from both of you. There's quite a few people asking other species. Can the scab mite live on any other species?
So cattle will host sheep scab mites, and that is a big issue in parts of the continent. Particularly in blue breeds of cattle, which are really susceptible to seroptic mange, which is essentially sheep scab in cattle. We don't have a lot of it in the UK, but we do have the odd incursion every now and again. Perhaps a good thing is that it's really difficult to get the mites to go from sheep to cows and cows to sheep. And so that actually is to our benefit. However, if it did get into cattle populations, that would be a different story entirely. That's pretty much about it. Rabbits can also host it, but again, they don't tend to act as a vector.
Not goats or camelids.
Goats and camelids can, again, they can also become infested. We have quite a lot of goats infested in Norway currently, and also llamas and alpacas as well. But again, the numbers of these in the UK are not really sufficient to make that a big concern at this stage. So.
Demelza asked, they've heard that, I don't know if Demelza is a SQP or advisor, but we've heard that people are still using Jeter's showers when speaking to people about scab. Mm-hmm. It's unlikely that they would get caught in the act. What do we do?
Hi Demelza. Yeah, I know Demelza does quite a lot of training on sheep dipping and so on. It is a problem. The people to report it to are the VMD. They're the ones that would take action, but we do need to supply them with some evidence as well. But yeah, the VMD are the people that because it is an off-license use, it's not legal, and they were the ones that would take the thing. But you've got to get some evidence. So if you get evidence of photographs, I know I've found some stuff on Twitter and I've passed it to them. We just need to start to make it quite uncomfortable for people if they get caught, but it's not easy.
Too Turley said, do you think the price of sheep dip stopping people using this method of control it? As a farmer, I probably think the actual price of the dip is the least of it, is probably the trickiness of disposal and the withdrawal periods and getting I don't know if you anything to add to that.
Well, yeah, I agree. You know, I mean, I think it's everything, as we've said, it's everything that goes with it, really, isn't it? So that is why I think the mobile dippers, the professional dippers doing the full job, obviously they have to make a living as well. But again, it comes back to what Stu is saying, you know, using the ELISA test so that we're only treating when necessary, and when we do treat, we get the best bang for our bucks. And you try and do it, if you're contiguous with other flocks, in a coordinated way. You know, not having to use it unless it's necessary is the way to save the money.
And the biggest cost is getting it wrong.
Absolutely, always is. Get it wrong and
Yeah.
you'll have to retreat, and then everybody suffers, the environment, everything. Yeah.
Yeah. Considering what they've said about persistently infested animals, once a flock's been diagnosed with scab, can they ever be free of scab? Give them hope, Stu.
Absolutely, yeah,
Definitely.
I mean, absolutely,
Mm-hmm.
yeah. In those cases, what's generally happening, and that's why it often happens in areas of common grazing, moorlands, is that they're just not being able to gather all of these animals. So you've always got this reservoir of infested sheep out there that just aren't getting treated at the same time as lots of others. And so, yeah, if you get scab like that in a persistently infested flock and you treat it, and everybody treats, and you can gather everything or as many as possible, absolutely, yes, you can. Yeah. But you've got to work together, and that's really, really key, especially on common areas of common grazing.
Yeah, and I think the other thing that we found with the RDPE project as well is that obviously the ELISA test has been able to find scab for us where before it became apparent, and in flocks where they didn't think it was there anymore. Because what happens is when a flock is persistently infested, you know, the level of immunity in there means that they're keeping it down. They're not showing the clinical signs. So it can work both ways. And using the test is the best way we've got of getting ahead of it, and keeping ahead of it.
Yeah, great. And there's a bit in there about as well people that are in denial, and I think there's a lot of work in the background being done about trying to take away that stigma, just trying to get people involved. And you've done that with the clusters, haven't you? You've got people in there, you've got people talking, so it's a group approach, and you know, it's no finger pointing or anything. Just get on and try and control it for the sake of the sheep.
Yeah, no, it's been amazing to have groups of farmers in a room sharing their results quite openly, working together. It's something I've never seen to do with sheep scab before, but I think there's a real will there. You know, once you break that down, people can really make progress.
And if people think they can form their own clusters with their SQPs or anything, then you know they should really think about, you know, chatting amongst themselves and trying to do something, because it's every bit helps.
Sure, I think in time, you know, we will have that outline, Stu, won't we? That we'll be able to provide people with an outline as to how you might go about that.
Exactly. Yep.
Yeah.
And we through these programs, you know, we've built up that body of evidence now that shows in a whole range of different situations and scenarios and environments, you can actually make that work, but you do have to tailor it to suit. And that's why I think that, you know, that kind of playbook that Lesley sort of mentioned there will be the sort of thing that helps people adapt to their particular setting.
Well, look, I think we've pretty much run out of time. I'd like to thank you both for all your presentation. It was just brilliant, and you know, it's just so much detail in there, and always learn something when both of you speak. Thank you very much. Thank you to Emma and Beth in the background working all the cogs. If there are any more, sorry, can answer all your questions. If there are any more questions, feel free to email Emma at the NSA or Beth, or you might be able to find Lesley and Stuart's contact details. I'm sure they're more than willing to answer you any questions. But I'd like to thank you all, and I'd like to thank you all for joining and staying on all the way till the end. And it will be available, I'm sure, to catch up on the NSA website and YouTube, wherever it all goes into the ether somewhere. So I wish you all a good night. I think we run out of daylight for checking the sheep, but thank you very much for joining us. Goodbye.
Thanks. Good night, everybody.
Thanks, everyone. Really appreciate your time. Cheers.